Hey, today at Optim Physical Therapist, we're here to talk about the pass-through movement. I picked it up in CrossFit and I've modified it and started using it in the clinic. And I think it serves the CrossFit community well. I think it serves the rehab community well also. And I use it with patients from teenagers to 60, 70, 80-year-olds, okay? Because we all need to be able to reach overhead, and the more mobility we have in our pecs and our lats to get overhead, the easier we're going to be able to do it and the less impingement issues we're going to have. So a movement I give my patients is basically they're standing, or to be honest, also like it's sitting. And what we'll do is they'll grip it wider than shoulder width apart, and I just let them grip it wherever they want to start. And then I'll have them sit down, chest up, and then elbows locked out, and like in our push-up video we talked about, we want to externally rotate. So elbows are locked out and externally rotated. External rotation, shoulder blades towards the hip pockets, and then send it back overhead. Now I don't give everybody the cues, the patients or CrossFitters, these cues right off the bat. I let them start and get a feel, and one of the common faults you'll see is the shrug. They'll shrug up. We want those scapula going into your back pocket. So you want to drive them down, externally rotate, and come around, okay? And then we'll drive back up and through. So scapula is into your back pockets, down and around. And the cheat on this, you'll see, is elbow flexion, right? An elbow flexion, what it does is it causes your shoulder, once you get that elbow flexed, to drive anterior, which isn't good for your long head of the biceps. It isn't good for impingement positions. It tells you your pec and your lats need some work, and or your lower trap sucks because you're not able to keep that shoulder in the down and back position. And so what you really want to watch for, because we love overhead squats, is in an overhead squat position, those elbows bend and the weight shifts forward. Or when we're doing pass-throughs, that elbow bends and then the shoulder shoots forward like that, which is a nasty position for the shoulder. So externally rotate, scapula into the back pockets, and drive through. As they get better, just inch their hands in. Okay? And eventually you're going to get so tight with your hand grip that they're not going to be able to pass through, and that's a-okay. We just need that humerus to be able to be straight, externally rotated, and in a good thoracic position well behind the ear. Okay? So that's your 180 plus a little bit if you're going to be doing overhead movements. All right, that's it for pass-throughs. Thanks.